CPR and first aid is great. I teach it, actually. I'm an American Heart instructor, taught for Red Cross for a number of years. And so I'm totally into CPR, but that is cardiopulmonary resuscitation. And that is done for somebody who has a medical condition where their heart stops. And you need to go in there and open up their airway by doing a head tilt chin lift and then pressing on the person's chest. Well, in a motorcycle crash, that is not the right thing to do. Matter of fact, you could make that person worse by jumping in, doing a head tilt chin lift and pressing on their chest. So we need to teach people how to properly respond to trauma. And that's really different.
Welcome to Riding Counsel with Rich Jaffe, where the open road meets expert advice. I'm Richard Jaffe, an attorney and biking enthusiast, and this is the podcast where we dive into the world of motorcycling, safety, culture, charitable giving, and riding right. So, whether you're a seasoned rider or just getting started, let's talk bikes, the road, and everything in between. Let's ride! Hello, and welcome everybody to another episode of the podcast here at ridingcounsel.com. Motorcycle law, charity, and a guide to riding right. And I'm really excited today because I have an incredible guest with me. And her name is Vicki Sanfelipo. And instead of me trying to rattle off all of the amazing things Vicki is about and has accomplished, I just figured I would let Vicki talk about who she is, where she comes from, and a little bit about her background. So welcome, Vicki. And also, I forgot to actually say, if you like what we're doing here, please like and subscribe. It would really help me out, and it would really encourage amazing people like Vicki to come back onto the show. So with that, please tell us about yourself, Vicki, and thank you so much for coming on the show.
Oh gosh, you said we just have a half hour, huh? The longer you live, the longer that list of things keeps growing, and I really have had an amazing, blessed life. It's like my motto is don't say no. And then, you can be led into things that you never thought would happen. So I'm a registered nurse, and I've been riding since 1987. I bought my first bike.
Wow.
So it's been a long time now, 38 years. And as a nurse who rides a motorcycle, people always thought I would know what to do at the scene of a crash. So I worked in ICU, I worked in surgery, I've spent 25 years in hospital nursing, but I started this program called Accident Scene Management, and I wrote a program called A Crash Course for the Motorcyclist so I could teach my friends how to pick my sorry butt up if I was the one who went down. It was like, okay, somebody's got to help me, and even as a nurse, I didn't feel properly prepared for what could happen out there on the road. So anyway, that long story short, through all these years, it has turned into the world's largest motorcycle trauma training organization. And I quit my job at the hospital in 2010 just to do this. I volunteered for the organization full time for 28 years. And have since then started now receiving a small wage. Not something anybody else would do what I do for that, but anyway. So anyway, it has been a labor of love, and we've trained over 40,000 people, closer to 50 now, have instructors in 6 countries. And we have instructors in 32 of the United States. So it's continuing to grow, and the stories we hear from our students are really what it takes to fuel continuing doing this great work.
This episode has been brought to you by Riding Counsel. Don't forget to visit us at ridingcounsel.com.
Wow, that's really incredible. I mean, you said so much there, and it sounds like the wealth of knowledge that comes from the accident scene management course that you teach really has a great basis in real life situations. I mean, you said you were an ICU nurse for a while. Is that right?
Yeah, I did critical care. I worked all over the hospital in float pool. I liked critical care, so that's where they put me most of the time. And then I worked in step down to critical care for 7 years before going to Department of Surgery. And back then when I was doing that, we learned everything. It wasn't as much where you're learning just one specialty, but I did everything from open heart surgeries to to gynae kind of stuff, so I did everything. And my last 8 years of my surgical career was as the educator for the Department of Surgery. So I trained new people and got them going.
Wow. So you're
Yeah.
really taking it a step further. I mean, not only are you gathering the knowledge, I mean, and this is firsthand experience. Now, I happen to know, we're not going to go into that story, but look, I'm not taking anything away from doctors, but really it's the nurses who have that personal care that are on you, monitoring the patients step by step, every minute, every hour. So you're right there. You're in the operating room and post-op. So you have this wealth of knowledge from from real world situations that you're imparting to other people.
It was really, again, a privilege to be able to be there during a tough time for people. It's a big moment when you have surgery, and it's not to be taken lightly. The person has done a lot to prepare. They're anxious, they're just wanting to get through this, and when they're put to sleep, those of us who are still awake and running around the room, we're their advocate, and we're there to make sure they're safe, and that they come through this okay. And so it really is a lot of responsibility, but I wouldn't put it that that anybody is better than anybody else, and the physicians do enjoy having a good nurse.
Yeah, yeah, for
you
sure, for
know
sure.
but I've told them many times I wouldn't be a doctor for all your money. So it's like, their responsibility and their call regime and the things they have to do, it's not to be taken lightly. They've earned where they are. So
100%, 100%. And we need somebody to, be the director and really have that level of care. So doctors definitely have a role, and not to take anything away from them. But I do thank you for all the things you've done as a nurse.
when I started nursing, when I got my first job, just to give you a little FYI, back in 1984 is when I graduated from nursing school. You can see that picture back behind there, where we still had the little hat and everything. So, back then, in 1984. I got my first job at the hospital, and I was making $8.74 an hour working night shift overnight.
Wow.
I made the same amount that somebody in a factory would make, or that kind of thing. So we weren't really valued as much back then
Mhm.
for our expertise. And it was kind of thought to be a woman's job. So, it has come a long way in the years that I've been around.
I mean, me personally, okay, since we're dating ourselves, I used to watch a show called Emergency, right?
Oh boy.
Yeah, and Dixie was the nurse. I mean, God, first of all, a name like Dixie, right? I mean, it's
Yeah.
so cliche, but yeah, that's with the hat and everything like that. Those are the kind of pictures I have in my
Do you
brain.
remember that Gloria nurse? She wore high heels.
Yeah,
You
yeah.
remember
Oh
that? It
my
was
God.
like, seriously? I don't think so. No.
So let's talk a little bit about accident scene management, and you know, first of all, accident scene management is pretty much like a verb, right? But you started this course to educate people. Can you tell us a little bit about this school or training, if you will? And there's so many kinds of trainings out there. There's CPR courses, there's first aid courses, there's EMT courses, but you have one, and it's called ASM, for accident scene management. Can you tell us what it is and maybe how it may differ from all the other courses out there?
Yeah, it has really been a surprise to most people until they take it. They don't quite understand what it is. So, a lot of people are like, well, I don't need that because I have CPR and first aid. And CPR and first aid is great. I teach it actually. I'm an American Heart instructor, taught for Red Cross for a number of years. And so I'm totally into CPR, but that is cardiopulmonary resuscitation. And that is done for somebody who has a medical condition where their heart stops. And you need to go in there and open up their airway by doing a head tilt chin lift and then pressing on the person's chest. Well, in a motorcycle crash, that is not the right thing to do. Matter of fact, you could make that person worse by jumping in doing a head tilt chin lift and pressing on their chest. So we need to teach people how to properly respond to trauma, and that's really different. First aid it addresses a little bit of trauma, but not enough. Not where it comes to serious trauma out on the roadside where somebody is seriously injured. So they'll do some of the stop the bleed type things in a first aid course, but we're actually starting with traffic control. Like, how do you get control of the situation? Where do you position your bike? What kind of supplies do you need so you can handle this situation? That's very important to talk about supplies. We actually teach people how to move someone. You hear in a first aid class, you never move anybody, but as a motorcyclist, we sometimes have to move somebody. So that's often that you can't leave that person where they landed. So we want to teach people how, when, and why. We demonstrate the skill, and the person return demos. That way, it's more stuck in their head. It takes time to teach critical skills, but we take that time in our class, and that's why the class is 8 hours long. So with that, I'm going to keep telling you what we teach. So then we teach assessment. Yeah, we teach. So that's just the prevent further injury part. It's called PACT, prevent further injury, assess the situation, contact the EMS, and then treat the injured person. So the assessment piece teaches them that they need to take a moment to assess, because in CPR, they tell you to leave immediately, go call for help, and then come back. And we can't necessarily do that in a trauma scene. Hopefully we have a cell phone that's working, but the places we like to ride are the ones that say no service. So we are not going to assume that you have cell phone service. So you have to take a moment to check on that person, make sure they're safe, see if there are any life-threatening issues going on. You can't just leave the person. You have to take a moment. Then we have contact the EMS as the third thing, not because we want you to delay a phone call, but because if you are in that situation, you would need to do the first two things before you would leave. So we tell people, contact EMS immediately, make that phone call immediately as soon as you have service and are able to, because you can assess and you can make that scene safe while you're talking on the phone. Then we get to our treatment finally, and that would be jaw thrust rescue breathing is something we teach that's trauma related. Where you open the airway doing a jaw thrust, which keeps you from having to do a head tilt chin lift. We then teach helmet removal. If the person is wearing a full face helmet and you don't have access to the person's face, you're going to have to take that helmet off. So we teach when, why, how, and have people practice that skill as well. They practice jaw thrust rescue breathing. Those are critical skills. And then we get into bleeding and into our shock, and then spinal stabilization. That's called the ABCs of trauma: airway, breathing, circulation, which is bleeding, shock, and spinal stabilization. And spinal stabilization isn't what it used to be. I mean, things are always changing in the EMS. It's a good idea to take classes every 2-3 years just to keep your skills up, because it does change. And they've gone from spinal immobilization, where you don't let somebody move at all, to spinal stabilization. And it's not uncommon anymore for the EMS to get there and ask somebody who's in a ditch, can you get up and walk to the shoulder of the road? We'll help you. And that's better than taking the time and all the effort that it takes to strap somebody down to a board and get them out of that ditch, which takes a lot of people. And so they've found that the injury happens at the time of the crash, and there's little evidence to show that minor manipulations afterward would make a person worse. But our bystanders, we don't want them to move anyone any more than they have to. That's our guideline, is less movement is better, and we should only move people minimally, as much as we absolutely have to, until the EMS arrives. They can make decisions that we are not qualified to make.
So this is really focused on motorcyclists, it sounds like, and it sounds like it's almost like a hybrid between first aid, CPR, EMS. It's a lot of training, but it's also it's all the good from all of these different disciplines put into a course where you have designed protocols to really help motorcyclists who have gone down.
Somewhat. And we don't teach CPR in our class. We encourage people to go take CPR, but to keep it separate in their heads, we want them to not learn it during a trauma course. So everybody knows to go to, most people already know all of that stuff. So we're trying to get them to take a moment, like don't get there. Don't get there too quickly. It's a last ditch effort to keep someone alive. Statistically, there's about a 1% chance of survival if you do CPR on a trauma victim. A motorcyclist that just crashed, there's a likelihood that they're not breathing because of neck injury. There's a likelihood that they could have chest injuries and be bleeding internally. So we're trying to get them to slow down and not get there until they've exhausted other avenues. So anyway, it's like we are teaching a higher level for sure. It is definitely based on US DOT first responder curriculum. It is a hybrid between Stop the Bleed, which came along after we started teaching, but we've incorporated that into our class. It takes out all of the other things they learn about the ambulance and paperwork and all that stuff, and it compresses it down into a short period of time. Honestly, you're asking people to learn a lot in 7 hours, but it doesn't have fluff. So it really is very focused on those first 5 to 20 minutes until the professionals arrive. It's more military, like combat medic, than it is like a regular first aid class.
Right, right. And
Like,
I think you really bring up a good point, because a lot of times where bikers go, and you as an avid biker know yourself, you said it before, sometimes you don't have cell service, and sometimes you're in an area that's so remote, even if you do call, you activate the 911 system, it's going to take them a while to get to the scene. So really it helps to know what you're doing at a motorcycle accident.
yeah, and the longer it takes, the I don't want to say lower level service, but the longer it takes, the more likely it is that you're going to have people who arrive, maybe 2 people on an ambulance, a driver and one other person, and you're going to have fewer resources, and they're going to need your help more. If something happens in town, we've seen the response. I mean, they don't need you.
Right, right.
You got a few minutes, and then you got plenty of help, and it's not so big of a deal. But when something happens out in the mountains or the fun places we like to ride, it can take a while for help to get there, and it's just you and that person. And I've had so many people who have said, oh, I know what to do if something happens. I just call 911. And I'm like, oh, that's really simplistic, like, yeah, and then what do? You watch your friend die? I mean, I don't
Right,
know, like
right.
maybe you could do something. So there's a
So in order for us to do things, when we happen upon a motorcycle accident, I mean, you could be in a cage, a car,
Mhm.
we call them
Yeah.
cages, but you could be in a car and have a lot of room to carry these things. But most motorcyclists don't have big trunks unless you have a tour pack and such. And we have saddlebags and maybe other bags attached to our motorcycles. What kind of things, without taking your course, maybe,
Yeah.
what kind of things should we carry in our motorcycle bags or with us at the very least to just be prepared, just in case we happen upon an accident or somebody in our group actually has an accident and we want to implement some sort of first aid help, I'm going to call it.
Well, if you go to roadguardians.org and click on the store, you're going to be given 2 choices. One is to go to the accident scene management store. The other one is to go to CPR first aid. That's actually my other company. That's how I volunteered for all those years. But this
Oh,
is
that's
a
great.
sample of a kit that fits nicely into most people's bags. And I create 4 different levels of kits depending on what a person has space for, what can they afford. So even the smallest kit would have a trauma shear in it, which is often missing from a first aid kit. A lot of people buy those little tactical kits and they look nice from the outside, but when you open it up and the trauma shear that's in there, or they call it a trauma shear, it's actually a baby trauma shear. You know what I'm talking about.
Yes.
It's
Yeah.
it has a plastic little thing on the little handle, but it will not cut through boots and leathers and that kind of thing. So when a person does this, I'm just showing you. I worked with a luggage company to
Yeah.
create a bag that everything is visual when you open this up. So you can see exactly what you have. I'm sorry, I'm too close to this thing to
No,
show
it's
you
great.
really
Show
well.
it's so organized in
But
there, and you can see everything.
yes,
That's
and you can
great.
see
Yeah, show us
everything, and
what's in there.
it's protected from the ground, so you have a
Mm,
place to work. So often, too, those little bags, they shove everything in there, and most people don't even know what's in there because they don't even want to take it out because it's going to be hard to shove it all back in again.
right.
But so they're grabbing things, they're pulling things out of there and looking for something, not knowing what's there, and they're throwing it on the wet ground or the sandy ground or whatever. And if you have to move between people, that can be an issue as well. So then there's a dressing bag with
Wow.
roll pack and burn gel and larger and smaller dressings, and something you can even make a second tourniquet if you needed to. So that gets laid on the ground too, and it's all visual. So I have been making these motorcycle based trauma kits since 1998, and
And
have
just to, I'm so sorry. I don't mean to
oh,
be
that's
rude
okay.
and interrupt you, but I just want to make sure that everybody knows and where to find this. And it's at roadguardians.org, right? Is it .org?
Yeah, and here's your
Roadguardians.org. And for everybody in YouTube, it's going to be down here. All the information is going to be down here. The links and anything that Vicki is talking about. So, but that is great what you just showed us, because just like you said, it's visual. So it's immediate access. It's not like hidden behind something that you have to unzip it, then you got to go in, you got to fumble it, and it folds up very nicely and very compact. So really very, very well designed.
Yeah, and we don't need all that extra stuff. So often there's a bunch of extra things in there that you're taking up space and it's not useful. I was at a trauma scene out on the highway where two motorcyclists hit each other at highway speed,
Oh,
and it was a mess. They shut down the 3-lane highway, and it was a big deal. And there was a guy who came running up with a Moto Medic kit, like he had gotten this and it had everything he needed in it. And he opened it up and it had like 2x2s. I mean, everything was in packages that you didn't even know it was in there until you tore it open, and it wasn't sterile. And it was, what I'm saying, the little two by
yeah.
twos, and the guy's bleeding from his head. And we're just like, okay, well, just give me the whole thing.
Right, right.
So it had the baby scissors in there, and it was, it had a flat rescue breathing barrier that you'd use for practicing in CPR. And so that your supplies matter a lot, and you want good supplies. And I think too often people don't know what they're supposed to have. And if they really want to know how to make the kit that they have better, I do list out every content in the kits on the website, because my
Uh,
biggest interest seriously is getting people to have the right tools so that they can properly respond. So they can look at what the proper tools are, like a 7.5-inch paramedic shear, and and they can look at what they have, and then they can say, oh, here's what I'm missing, here's what I should have. And whether you build your own and make your kit better, or whether you decide you want to purchase one, to me, it's all about, do we have the tools we need to do the job? It'd be like a mechanic going to school and being told, oh, you only need the knowledge, you don't need tools. Don't worry about the tools.
Don't worry about these little details.
Yeah. Any EMT is, that's a funny thing, is when you were riding with an EMT, you're like, really? You take all that space for first aid supplies? And the
Yeah.
EMT is like, oh yeah. Oh yeah. I'm not I'm not going there without, all this stuff. So yeah, most
So
important thing really is gloves, and a good pair of gloves, like a good nitrile gloves. Those are number one most important.
So we call that BSI precautions in some terms, right? Can you tell
Yes.
us a little bit what is BSI precautions? Okay, tell
Well,
us a
more people know of it nowadays because of COVID and everything as PPE, personal
okay,
protective,
okay.
personal protective, whatever. Um,
Personal protective
Equipment,
equipment.
equipment, that was it. Equipment. You know.
Yeah,
Um,
but stuff
yeah,
to
so
prevent like
anyway, PPE.
we don't want bloodborne pathogens, the
Right.
bad stuff coming from people who we don't sometimes we happen on accident scenes and we don't know them. And
Mhm,
and they might have some sort of pre-existing or underlying condition where we want to protect ourselves, right? And
mhm,
I know from at least my prior experience as a medic, we always would have to take care of ourselves first before we take care of anybody else. And I
yes,
don't know if that's true in the
mhm.
accident scene management world.
It
Is that
is,
the
yeah.
same
We
kind of
tell
thing?
people we tell people you are number one. You can't help somebody else if you get injured, and you are not expected ever to put yourself in harm's way to help someone else. There's always stories out there about somebody who's a hero because they put themselves in harm's way, and I can tell you that a lot of the professionals kind of roll their eyes and go, oh boy, now we're going to have more people rushing in and putting themselves in harm's way because they want to be a hero. And heroes have to take care of themselves too. So we want you to take time to take care of yourself, and that's sometimes using the things that you have already available to you. So motorcyclists wear a lot of PPE when they're riding, but what we do is we're approaching someone as we start taking all that protective stuff off. And best thing to do is really get your gloves switched out as soon as possible. But they're even the helmet, if you're wearing a full face helmet, it's protecting you. Most people want to get it off so they can communicate with the person more easily. But you do have to think about what's coming out of a person's mouth. Somebody told me, they said, well, you wouldn't care if it was your husband, right? Like you would just kind of go for it. And I'm like, oh, he's a dirty boy. He likes it when I call him that. Yeah, I'd use PPE even for him. But it's not because of that. It's really because of cross contaminating the scene. So we don't want to get blood moved from here to here to here to here. It's just good practice.
Right,
No medical professional is going to not care about that. We
right.
it's drilled into us. We treat everyone as if they're contaminated, and we try not to cross contaminate our scene, especially a former surgical nurse. Like I'm like,
So
really?
we're talking a lot about traumas here, right?
Mhm.
And accident
Yes.
scene management.
Mhm.
And I'm wondering, oh, can we really be prepared for every scenario out there that we're going to face? I mean, from like an emergency first responder point of view.
I think we can, I don't know that we can be prepared for every scenario that goes on. So we don't try to do like in this situation, you do this, in this situation, you do that. It's more of a global overview of how you approach something and some basic principles. Like, for instance, a basic principle is you always move someone head first if possible. But it would not make sense to move them head first if their feet were, if going head first would be out into traffic.
Like,
So
let me ask
we
you,
teach principles.
what would be your feeling on bikers carrying certain things with them? Call it, you know, uh, aspirin. If somebody like has a heart attack, I've read that we give them aspirin or different other kinds of medications. So there's a medication out there that everybody knows it as Benadryl, but it's something I think it's called diphenhydramine. If somebody has like a bee sting or an allergic reaction to something, should we be carrying
We
that? Is
we talk about those things in our advanced class. Our first class is totally focused on trauma, and then if people want to come back for another 8 hours, we get into roadside medical issues. And I will say that my third level pack starts carrying medications, electrolytes for dehydration. That's a big problem for motorcyclists. They don't even recognize how important it is.
Mhm.
And we do have an aspirin, one package of aspirin in there because we don't want them to give people aspirin if they have a trauma, because it reduces bleedings or causes it reduces the ability of the blood to clot. Excuse me, so
Right.
that it would cause more bleeding. So it has ibuprofen ibuprofen, Tylenol. We don't have the Zyrtec in there, but we don't recommend Benadryl anymore. We used to, but now we have things that don't make people sleepy, like Claritin or Zyrtec. So we recommend those things, but we let people bring their own. Those are recommendations. So that, yeah, roadside medical concerns can come up just as much as anything else. So we hit all the high level ones, the more likely ones. We do asthma, anaphylactic shock, diabetes, heart disease. We do overdose and talk about and do Narcan. And
Right.
so we do all of those in our advanced class. And teach oral airway insertion. We teach pressure points to control bleeding, assisting the EMS with extrication. We do role play. We learn how to get a motorcyclist out from underneath the bike when they're trapped underneath. And, so it's really fun. If you give us another day, we will make sure we value your time.
No, that's great. That's awesome that you do so much. I mean, for the motorcycle community, these are incredible things. One thing that I've seen out there also, and I don't know if your course condones it, but there are ID bracelets out there, and a lot of them have like QR codes where if somebody really needs to, maybe a first responder, somebody from the EMS, or even somebody who happens upon an accident scene, you can actually scan it and they can get a bunch of medical information that really might help, especially if the injured person is unconscious. Have you seen these things come into play, or you see these things out
Yes.
there?
Yes. As a matter of fact, that's really, really increasing in popularity over this last year. That's on my list of people to reach out to and on our outreach list. So I want to talk to them a little bit more and see if we can partner with them, because I think that, with all throughout the years, we've struggled to try to have a good system for finding out, ice on a phone in case of emergency, that type of thing. But there's so many variables. There's so many, like, where it might be kept, where, what if a person's information changes, just so many variables that not one solution has been great. But this one actually is pretty great. And
Right. Well, if I may, I'm going to talk a little bit about personal experience.
sure.
A week before a Okay, I was riding in Connecticut with my club, and all of a sudden, I felt the proverbial elephant sitting on my chest, and I started to get diaphoretic, meaning sweaty. I started to get
Mhm.
sweaty, and I couldn't believe it. I pulled my entire pack over, and it turns out that I was actually having a heart attack. And a week before this whole thing happened, I got one of these ID bracelets, or not bracelet, but something, and I
Mhm.
was wearing it around my neck, and I also have it on my wrist, by the way. And the hospital or the EMTs scanned it. They had all my information. The hospital scanned it. They had all my information. And I was in the cath lab. I would say from scene to cath lab must have been about 15 or 20 minutes. It was very, very quick, relatively. And it was all because of these ID bracelets. So, I really think they do help. And
Yeah, for
um,
sure.
yeah,
Like
I think
your
it's a great
contact
deal.
information, like who should they call? I mean, it's really, I love that whole idea, and I think it's. I didn't realize they made one for around the neck. That's great too. So, do you want to tell people where they can get that?
Well, I'm going to share the links out here, but it's
Yeah,
I think it's find no id.me, id.me, or find my ID. I'm going to put all the links down here, and I'm also going to share it with you when
yeah.
this is
Thank you.
over. So maybe you can also incorporate that. But I guess a lot of different advancements and technologies have come through that help injured bikers and help us get medical care a little faster. And it sounds like you've implemented this incredible course, accident scene management, but also you're like on top of protocols that are like cutting edge.
Well, we have a program committee. I have an emergency room physician who he's got 50 bikes or so. Maybe he says probably more. He hasn't counted lately, but anyway. So of course, a rider, we need people to understand the whole motorcycle component. So he oversees our curriculum and signs off on it. We have a flight nurse who does EMS education for Medical City, Dallas. So she's high level, and we have a paramedic from South Carolina who oversees the curriculum. So we have this program committee, and we're also accredited by the Commission on Accreditation for Pre-Hospital Continuing Education. So our class even qualifies for EMTs to get credits, but the general public is our basic audience, and they're getting this higher level education. I'm hoping you'll sponsor a class for me.
I am definitely going to do this because this interests me like to no end. I mean, I have a background as a firefighter and a paramedic, and I love this stuff. And it's so great because it's geared towards motorcyclists, and it starts just like you said. I mean, as motorcycle riders, we prepare for the ride long before we even get on the bike, right? We're checking the weather, we're wearing the right clothes, we're doing all kinds of things. We do our pre-check on the motorcycle even before we get on, or at least that's what we're supposed to be doing. But there's really not that kind of awareness when we're going to be dealing with accident scene management. And your course seems to teach this because you're talking about preparing the actual scene, making it safe for people to actually treat the patient and getting the patient to a safe area. So this is really like free.
Yeah.
This has
This is
all
something every motorcyclist should know. And
right.
Our best outcome is if all motorcyclists knew how to help each other. That would be our best scenario. And we call each other brother and sister. Why would we not want to be there? Why would we not want to know how to best help our friend? And I will tell you that the emergency room physician who is on our program committee, he joined our efforts because he came to the class because he was a friend of mine, and I'd done some riding with him, and he was just trying to make me feel good, So he came there. He says, I didn't think I'd learn anything. He walked away from there saying, "Wow, I really learned a lot, and thank you. I was not expecting that." So you will learn a lot regardless of your background. I call it boot camp for the motorcyclist. No matter what your background is, we're going to bring everybody into the same room, and we're going to get on the same page. So nobody gets to skip boot camp. The most likely person to be at the scene of a motorcycle crash is another motorcyclist. So we really owe it to each other to all learn how to help someone.
Well, I want to ask you something. I guess it's natural for me to ask because not only do I ride motorcycles and do podcasts, but I happen to do personal injury law, and I represent a lot of motorcyclists who unfortunately get hurt as a result of negligence of other people. And if you haven't guessed by now, my website is ridingcounsel.com. But I wanted to ask you, do you also incorporate any kind of legal aspects to your teaching of what goes on at accident scene management?
Mostly we talk about Good Samaritan laws. Because I find that if people are afraid that they are going to be sued for trying to help somebody, they're hesitant to learn. So we do that right away in the introduction. We talk about Good Samaritan laws and how you should not do anything grossly negligent, but as long as your intent is to help that person and you stay within your level of training, which means that if you get more training, you can do more, then you're safe. You don't hear about people being sued for trying to help somebody because Good Samaritan laws will protect you. So every state has its own. And you should know get a basic understanding of what Good Samaritan laws are, like what I just said. But for instance, in Minnesota, you have a duty to act. You cannot just drive by without at least making a phone call. But if you're in Illinois says you can only practice to your level of training. Most of the states just say as long as you don't do anything grossly negligent and you weren't the one who hurt them, you don't get out of it because you help.
But I'm so glad you mentioned it. I mean, they're called Good Samaritan laws, and every state, as far as I know, every state has one that protects somebody who comes to the rescue of somebody else. So please don't think like, oh my God, I'm going to have to buy insurance. Somebody's going to sue me. Everybody's litigious in this world. Help your fellow biker because you will be protected. The law actually is on your side. And I want to go even a step further because in New York, there's a concept called danger invites rescue. And that means that if a biker was hurt as a result of the negligence of somebody else, and then you as a rescuer come upon the scene and you get hurt at that scene, then you can actually sue the person who originated this whole thing and who was negligent in the first place. So it's a
Wow.
concept called danger invites rescue. And I just want to emphasize, and I'm sure you agree with me, that look, if you see somebody down, go help them. It's not,
Yeah,
you're not going to put yourself at risk,
right.
especially if you take BSI or personal protective equipment
Mhm.
precautions, but go and help them. Help them. Don't be scared of any legal ramifications that's going to happen.
And call you if you need some help. So,
Yes, definitely
you
call
know,
me.
I
You can
mean,
call me for anything.
yeah,
Call me for
yeah. I
anything.
mean, I know that you know, people sometimes just need your advice, and it doesn't hurt to call and get some advice, and find out, do you need help or do you not need help? Are you, did you do the right thing? So I think that, having a biker who is also into personal injury law, you understand more about what we are facing when we're out there, our vulnerability that we have, but also our fierce freedom, so our fierceness where that is concerned. And, I just think that it's great to have somebody who's on our side.
Well, thank you for that. I really appreciate that. And I've been sucking up so much of your time, but I really appreciate it. And I
Great.
just want to go over where to find you again, because this training is so incredibly important. And I really implore everybody, please, at the very least, go visit Vicki's website, Accident Scene Management, and I'm gonna spell it out, or Vicki's gonna spell it out for everybody, especially people who can't see it on YouTube.
Yeah.
But please go check this out, and even if you can't take the course, which I really hope you can, take a look at the trauma kits. Take a look at all of her offerings that are on the website. And not only will you get some really good things to take on your trips with you, but you're supporting such a great organization. So Vicki, just please, can you tell us where we could find you again?
Sure. And I just want to mention that we are a 501c3 nonprofit organization. We were one of the very first motorcycle safety nonprofit organizations. From 1997, we became a nonprofit. So we are 501c3. But they can find us at roadguardians.org. If you type in accident scene, that's fine too. So we have accidentscene.org, but roadguardians.org is where it's going to take you to. And that is that's our Road Guardians program. People can join that and support our organization with $25 a year. So I mean, it's just a way for us to pull people in. But you'll find a lot of information there from where we have instructors. We've got a map of that. We've got a map of where our classes are. We have some online classes. If you don't have an instructor in your area and you just want to learn something, we have that opportunity for you. We have a lot of motorcycle safety resources there, and the supplies, of course. So there's a way for you to reach out to us, and you can just click on a contact us form and let us know what you're looking for, and we'll try to help you.
That's amazing. That's incredible. And for all you clubs out there, please get in touch and have Vicki
That's the
do
best.
some sort of group class for you all, because it's really valuable. And I just encourage everybody who's on the road to get this course. And I know I certainly intend to. And I'm really happy that I came across your website and all the information. But thank you so much for all of the insight, for all of the information that you have given us. And I really appreciate your time. And all the information is going to be below in the links for you people on YouTube. And if you have any other questions, you can always find me at ridingcounsel.com. And I'm happy to, again, share all of that information. But until the next episode, I'm going to have to bring this episode to a close. And it's been a real pleasure talking to somebody so accomplished and has done so much for the biking world. Thank you so much, Vicki, for spending the time with us.
You bet. Thanks a lot.
And that's a wrap for this episode of Riding Counsel with Richard Jaffe. Thanks for tuning in. If you enjoyed the ride, be sure to subscribe, leave a review, and share with your fellow riders. Until next time, keep the rubber side down and ride safe.